Welcome to the breakout session on the County of San Diego's excessive heat plan. Dr. Wooten is leading the session along with three of her colleagues who I will briefly introduce. By the way, my name is Mary Lou Lindegren. The first is Corey Oss, is the EMS coordinator with the Public Health Preparedness and Response Branch. PHPR coordinates with healthcare facilities and other partners in developing public health and disaster preparedness by dissemination of risk assessments, trainings, public health guidance, and real-world emergency response. And then Kristen Smith works with the Aging and Independent Services, a department within the County of San Diego Health and Human Services Agency. As Chief of Agency Operations, she oversees a variety of programs for older adults and also serves as the technical advisor on access and functional needs for the county's disaster response efforts. And finally, Alex Tardy has worked at 6 locations at weather forecast offices in the United States during his past 28 years of service. He is here in San Diego as the warning coordination meteorologist, and living in California has shifted interest and expertise into climate and fire weather, including post-wildfire and heat health impacts. Thank you very much and welcome to the session.
So good morning, everyone. Given the fact that all of you attended the first session, I am not going to go into details in that, but what I want to do is to set up, and the focus is to set up the framework for our excessive heat response task force and our response plans. And given the fact that the response plan and the ConOps plan, which is a document that says who's going to do first, those are confidential documents that are shared with internal and the several external partners, but we have a consumer version for the general public that's on our excessive heat website. So just to set up, we talked about the fact that had a continuing warming of the earth. So we have an increase in the heat alert, particularly over the past 4 years. The numbers have been larger than in prior years. So it was, and it's also in planning. 2 years ago, we were planning for what if the temperatures on the coast become much higher than we are accustomed to. So San Diego, we look at the temperatures across 4 topographies. We have coastal, we have inland, we have mountains and deserts. And that helps to determine whatever the temperatures are in those various areas, helps to influence the phases of our response plan. And that information comes from the National Weather Service, which Alex will go over the details of that. So just historically regarding the coastal region, in September of 1963, and you would even think that this was possible, but we had a temperature on the coast of 111 degrees Fahrenheit at the airport. And then we've had at least 4 other years where the temperature has been over 106 degrees. So as a result of that, in this last response plan, we updated it to include information enhanced information about cool zones and about transportation. Because if someone needs to get to a cool zone, they may not have transportation. So that was an increased element that was added into our plan 2 years ago. So our plan is issued every 2 years on an odd year. And we have updated the plan for 2023. And now we are currently working on, which will probably be published in a couple of weeks, the consumer version of the 2023 plan. So I talked about this. Our task force was really spurred or influenced. The development of it was influenced by the extreme heat wave that occurred in July 2006. And specifically for San Diego, we had almost 200 hospitalizations, like 193. We had ED visits, 192 plus ED visits. There were 32 hospitalizations, and we had 2 deaths for this year alone. And so now the past 2 years, we have a report that we issue to go over the prior year's ED visits, hospitalizations, and deaths. So in this next slide, these are heat-related illnesses in vulnerable populations. I actually talked about this earlier this morning. So we know who's vulnerable, and our last speaker talked about this as well. It's always pretty much the very old, the very young, and those individuals that are marginalized, whether it's people of color or a homeless population, people that work out in the field, our migrant workers, and those individuals that have jobs working out in the field. Those are those individuals that are most vulnerable, and particularly people that have chronic diseases. I love the comment about, what we could do in our youth. We can no longer do that as we get older. We are on more medications, and all of those factors influence our response to excessive heat. Pregnant women as well, and individuals with mental health issues. So those are our vulnerable populations. And so here I wanted to share with you the authority when it comes to when we have these excessive heat situations. And with any emergency, the health officer can proclaim a local emergency, but we've never done that for excessive heat in San Diego. But if we had to, there is the authority to do so. And so I talked about the 3 documents. So these are the 3 documents that we've generated related to our excessive heat response in San Diego County. The first one there is the excessive heat response plan. Then we have a document that specifically speaks to, of all of our partners, what is your role as it relates to phase 1, phase 2, and phase 3. And Corey will go into more detail. And this is this consumer version. So this is online. This is the version from August 2021 that's currently online. This will be replaced in about 2 weeks because it reflects the most current actual response plan that we utilize internally. And so it has an overview of excessive heat mitigation strategies. Now, the 2021 has information about COVID-19. We changed that to just infectious diseases. So it's not specifically focused on COVID. So that will be in the new version that it will be posted in a couple of weeks. And then extreme heat events, overall roles and responsibilities of our partners, how our plan is activated, and then communication efforts, and then definitions and resources. You've seen this again from this morning, showing the alerts, the number of heat alerts that have been issued by the National Weather Services. Again, the point here, they've increased over the past several years. So this showing the histograms is one way to show that. And I also wanted to show in the table just 2 different ways. And here in the table, we stratified by warnings and advisories. And then lastly, I wanted to share with you data. It's always important to show data. So this is online, our excessive heat annual report. So our latest version has been, so you can go in here, look at what happened last year in terms of ED visits, hospitalizations, deaths, and compare that to even prior years. And also we have a website presence on our Community Health Statistics Unit's website. And there are the 4 categories here that these green bars, the orange bars, but this is an environmental health dashboard focused on climate change. And also it shows health outcomes. So we have information about excessive heat in any given year, most recently 2022, where we had 32 days of excessive heat. Then as it relates to deaths, hospitalizations, and ED discharges, for 2022, we had 8 deaths, 46 hospitalizations, and 153 ED discharges or visits. And then here is some additional information that's on our county Community Health Statistics website, where it shows you can go in, and this is on Tableau. That's the document or the system tool that we use to display data. So it has information, and this is just an example. You can go in and put in your area. It identifies census tracts. And actually what you can do when you go into the website, you just hover over these areas, and these are various census tracts. So if you want to find out in your particular community, this specific example is for census tract 27.2, but it's that little area that's in that's outlined in black. And then there's a bubble that comes up that tells you what region it's in, what community, and then the actual percent of population in that tract. So for vulnerable populations, that's on the right side. It tells you who the vulnerable population are. On the left side is the mitigation factors. And so it gives you air conditioning in home and the percentage of homes with air conditioning. So, and the results there are at the bottom. The vulnerable population, 3.8% with chronic kidney disease and 28.7% of the households with central air. So it's just a tool that you can gather more information for your particular area, your practices, and where you live. And then we conduct training. These are ideas how the county can interact with. This was a question asked of our facilitators earlier this week. How can the county interact with our healthcare systems? So here we suggest that you can conduct trainings, or we all can be involved as partners to conduct trainings for healthcare providers to address health impacts of excessive heat. And that's what we've done here today. Today, we're focusing on clinicians, but at some point in the future, we can invite patients to a similar overview. And then prepare emergency departments with knowledge, tools, and resources to consider climate as an impact with their clients and patients. The heat action plan, we have that document in the back that I mentioned this morning. So one pager front and back. So we encourage you to utilize that, and then consider implementing cool zones, whether in your institutions, if you're part of a large healthcare system, or partner with entities in your local communities. But with that, I'm going to now pass it on to Corey so that he can talk further about our response plan. Corey?
This is the clicker. Good morning. I made it by 1 minute. Good morning. Almost noon time. My name is Corey Oss. I work for Public Health Preparedness and Response. So like the name says, we do preparedness and response activities for the healthcare sector. So I have emergency management and an EMS background. So we do planning activities in our department for, we work in conjunction with Office of Emergency Services, but basically any disaster that occurs has a medical health component. And so that's when our office activates our medical operations center, and we go through some actions to assist the healthcare community for how to respond. So like Dr. Wooten mentioned, we have developed three plans to guide the county's response to excessive heat. Two of them are internal, the heat response plan and the concept of operations. And then one that she showed was our consumer version, which is in its final phases of being updated for this year. So our general responsibilities I'll show you in a couple of slides. We coordinate response efforts with a number of internal and external stakeholders for a lot of different actions, a lot of communications, a lot of information sharing, or doing outreach activities. We are heavily driven by our partners at National Weather Service, which Alex will be presenting here in a minute. And we work hand in hand with our community partners for actions to prepare for and then respond when these heat events occur, which are starting to be more year round, kind of like we used to say that there is a wildfire season, and now it can be in February or December. And so it's almost, 12 months is the season now. We do work with AIS, and Kristen will go over this in more detail in a few minutes. We do publish a updated cool zone list every spring. And then as part of that, we work with transportation providers and 211 to provide resources for community members who may not have a way to get to a local cool zone that's near where they live. So there's 3 phases of our plans when we have to activate. Phase 1 is kind of the off season. That's when we do our plan updating, adding different stakeholders, getting everyone up to speed, updating our contact list to make sure that when we do our outreach for an activation, that everyone receives our information. And then the heat alert and the heat emergencies are just different levels, and I'll show that here in a second. And like I mentioned, May through September are typical the warmer months in San Diego County. But just last year on Super Bowl weekend, which was the last weekend of February, we had an activation because I think on the coast it was pushing 90 degrees or so. So it's starting to happen in these longer parts of the year. So we're going to take a quick look at some pieces from the excessive heat response plan. And here's our activation points. So like I mentioned, phase 1 is seasonal readiness in fall through spring, kind of getting all of our ducks in a row just to get our plans updated and our contact lists updated. Coordinate with National Weather Service. Oftentimes there's a little bit of language updates for what industry is moving to. And then we have phase 2 and phase 3. And we designed this in a way where it's temperature and geography based. So if it's 105 in Brago Springs, which it probably is today, that's just a normal Saturday for them. But if it was 105 at La Jolla Cove, it'd probably be on the news. Like we said, it was 111 in 1963 or whenever that was, I mean, that's unprecedented. And so if we see that on the coast, it's much different than if we see it inland in our other areas. And then we also break it out by time, by what time of year it is, from October to May. And then right now, like we're in the June to September, it's the scale slides a little bit to the right in terms of some warmer temps. And important to note that we don't issue a heat advisory for the desert just because people move there because it's hot. And so they're aware of that anyways. And so we don't need to tell them that it's gonna be hot tomorrow because it's almost always hot. And then phase 3 is our highest level, multiple parts of the county or multiple regions being in a high heat activation or a single one going over certain thresholds. So the heat response plan spells out these things that we noted up here, the authorities, which Dr. Wooten showed before, a number of definitions that we use in the plan for heat alerts, heat activations, heat events. It identifies who is on the task force from not only internally to the county, but also a handful of external partners. The activation phases I just showed, some mitigation strategies, which Kristen's going to cover here in more detail in a few minutes, communications, and then plan maintenance. So it spells out in the document how we're going to keep that up to date. We choose the odd years to do like a deep dive refresh, and then the even years is more just department updates, some language, and some more of a lighter update like that. So like I mentioned, notification and warnings. Luckily, National Weather Service, that's what they do. They inform us typically at least 5 days in advance when we're going to have a heat event coming. And the accuracy of that, as we know, gets a little more accurate as we get closer to the event. So that allows us to broadcast out our message to our stakeholder group that, hey, next week, starting on Tuesday, in the mountains and deserts, we're going to have some heat. And so we do our communications with our team and just let everyone know. And then we ask for information back. Typically that is, do any of the cool zones have extended hours that we can publish? Office of Emergency Services rebroadcasts a lot of our information on their Alert San Diego websites and social medias. County Communications publishes news stories. Department of Animal Services will put out some tips for how to keep your pets safe during some heat. And then we ensure that our partners at 211 San Diego have all the information they need for when people call there looking for information or assistance, that they have the most up-to-date info. So some strengths of our plan. We're constantly, like I have a document going right now, 2024 update ideas. We've been getting a lot more information from the state and the federal level for climate change and heat. So every year we're talking about how can we make this plan better? How can we build on our partnerships internally and externally? Office of Homeless Solutions has taken a greater role in our plan due to the ongoing crisis with unhoused people in the county and downtown. We're always looking to get more cool zone locations, like Dr. Wooten mentioned. So we can get you in contact with Kristen's team if you have any ideas for some of those locations. And then here's a quick glimpse at our concept of operations. This is where the rubber meets the road for the actions that our stakeholder group takes. And breakdown down in the bottom right for some of the different temperature thresholds that we use for those different geographic areas, and also depending on what time of year. So obviously a little warmer in summer through fall, and in the off season it's going to be a little bit cooler. And here's an example of our alphabet soup on the right of all of our different departments, from public health, EMS. EMS is a big partner with us. They monitor the 911 pre-hospital system, and they gather all that information and they feed it into us, which gets turned into a really nice report, which Dr. Wooten showed a minute ago. And all the way up the chain, we report up to the region, which then goes up to the state, to CDPH. And so we have that pathway for communication for when these events occur, and we do report up there. So this is what that document looks like for phase 3. There's a similar pages in our ConOps for phases 1 and 2. And then each department, this is a big part of the updates every year when we say, hey, AIS, what new stuff are you doing? Can we update it? Should we, what's going to make it more relevant? So here's a listing of all of our internal stakeholders. I got a little fancy with my PowerPoint. It changes here. So AIS, I'm not going to go into detail. Kristen's about to cover that in a minute on her slides. But I'm just highlighting some of the ones that we work a little closer with that have more actions that go out to the community. So like I mentioned, County Communication Office, they do news stories. They're our lead. They're the voice of the county for our social media leads, and just getting the information and the word out there to the general public. Our county libraries and Parks and Rec are our major cool zone sponsors. Borrego Springs Library is our big one. Like, hey, are you going to be open late this weekend because there's a heat event? That's our one of our main locations out there in the desert area. Office of Emergency Services, like I mentioned, they do generalized emergency management planning, but oftentimes these heat events occur at the same time when there's heightened wildfire risk. So we work hand in hand with them with these forecasts and make sure that we're sharing information, and when there's an activation, we're involved with that, and we can make sure that they have all the most up-to-date information. My home department is Public Health Preparedness and Response. We're kind of the coordinating entity for all these groups, make sure that these plans are utilized and updated. And then EMS, anything 911 related, ambulance, they track all that data until the time they take the patient inside the emergency departments. And then that's a separate data set, but we capture all that on that end of year report. Amazing data set from how many calls they're getting, locations, and then the severity levels, and then any fatalities that are involved with it. Here's a listing of our external stakeholders. Like I mentioned, 211 San Diego, great partner with the county for information sharing on their website. They have a really nice interactive website that you can use, or you could just call 211. They'll tell you what you need to know. Cal OES, state level, like I mentioned, they're our partner for reporting up and also making sure that we have any sort of mutual aid support if we need to, and also it's a pathway for information sharing. National Weather Service, Alex is going to cover that in a minute. And then San Diego Gas and Electric is a great partner. They have their own team of meteorologists that they have for their own predictions and weather, but also they have a medical baseline database. And so they've gotten really precise in the last several years, where during a high wind event, they'll have to de-energize certain portions of the power grid, and they can look at their database and say like, oh, this address has a medical baseline customer, which means they have some sort of home medical device that runs on electricity. And so they will contact that person or even go to that location and make sure that they have what they need, or help them find somewhere else where they can go that is not going to be shut off. So these are our external partners. And then some of the mitigation strategies, cool zones, and the fans program are going to be covered in more detail by Kristen. And then, like Dr. Wooten mentioned, we the last update was during our that little thing called COVID-19 a couple of years ago. And so we made the infectious disease messaging a little more generalized this time around, just for, practice good hygiene, wash your hands, wear a mask if you feel the need to when you're in these settings where there's multiple people. That's it for me. I'm happy to take questions. Otherwise, I'm going to turn it over to Kristen. Thank you.
Can you all see me in the back? Okay, great. I'll stay right here. All right. So hello, everyone. Some of you have probably heard of our agency, Aging and Independence Services. We're part of the county's Health and Human Services Agency, so a sister department to Dr. Wooten's Public Health. Some of the programs that you all as physicians are probably a little bit more familiar with that we operate are adult protective services and also IHSS, in-home supportive services for low-income anybody with disabilities that needs help in the home with assistance with activities of daily living. And so these are some of our more vulnerable residents. So what I'll be talking to you about today is giving you some information about community resources, the cool zones, and several aspects of that. And then also information about disaster planning, emergency planning. So you've heard about our booklet, which I think it looks like this. I think you all have it in the back. And then how you can get involved and how you can help your patients. So in the disaster planning, emergency planning world, we talk about people with access and functional needs, or AFN. And so that can be older adults, people with disabilities, also people who are pregnant, people with language barriers, anything that is not the mainstream for needs in any kind of emergency. And so our staff, since AIS, that's kind of our specialty, is older adults and people with disabilities, we are part of the emergency planning, the Office of Emergency Services, ongoing planning for disaster planning, and we serve in the AFN technical advisory role when the Emergency Operations Center is activated. And we've already talked about the risks that older adults are at during extreme heat. And so I will just move on because you've heard it from several angles so far. We're in the same task force that Corey is talking about. And our role in that is to manage the Cool Zones program. We don't take the phone calls. 211 takes the phone calls. So if you have a patient that needs to access a Cool Zone, tell them to call 211. But we organize it. We recruit the partners. We stay in touch with the partners. We see if they're going to do extended hours, and then we update it on the map. And so there's a map on our website, on SDG&E, and I think 211 might have one. But if you go to coolzones.org, you can find all of that. And so then we stay in touch with the task force and keep them updated about what's going on with Cool Zones. So what Cool Zones looks like is basically 120 sites. So when I was a kid, if I was hot in the summer, I grew up in North Florida and we didn't have AC, we would say, well, let's go to the library, and I liked to read, so that worked out, or let's go to the movies, but that costs money. But what a Cool Zone is, it's a place where you can go. It's a regular place. It's a library. It's a rec center. It might be a church. It might be a mall, but where you can go and you're not expected to spend money, and you can just be there. You're allowed to be there during their normal open hours. And then sometimes during an extreme heat event, some of them will agree to extend their hours because maybe it's going to be hot into the evening, and maybe the library normally closes at 5, but they can extend their hours during that heat event. So it's that network of sites that have agreed to be a cool zone. And you'll hear it nationally called cooling centers. So in disaster planning parlance, it's a cooling center, but here, cool zones. So it's open for anyone. We concentrated on older adults and people with disabilities, but they really can be for anybody. And then there's a fan aspect of the program, which I'll go into. And another benefit of this, and I think especially since we've been hearing about today with climate change, is by having people go to a cool zone instead of using their broken AC unit or no AC unit, you're collectivizing it, so you're saving on energy. So this is a map showing the cool zone site during a heat warning and advisory. So the purple are the hot areas, and then the lighter colors are the advisory areas. So excessive heat in the purple. And I'm sure if you look at this map, you're going to go, well, gee, you have more cool zones towards the coast, right? And that's because that's where we have more population. And so, yes, there are fewer sites in those hotter, more rural, less dense areas, and we are always recruiting for more. So then if people can't get to a cool zone, if they don't have a car, if there's no public transportation that easily takes them there, you can call 211 and they will help you get a ride. So if there's not public transportation that would get you there, they'll actually set up rideshare for you. And then the fan aspect, we have electric fans. So far this year, we've given out 400. And it's also important to note that the electric fans only good to use when it goes up to 90 degrees. So if it's beyond that, you're going to want to get yourself to a cool zone if you don't have AC. And so to be eligible for a free electric fan that we send out to your house, you basically need to meet some low income requirements, not have AC, and not be able to easily get to a cool zone. And you can call 211, and then there's also a form on the website that you can fill out. So last year in the 2022 season, if you will, so cool zones, we officially operate them from June 1st through October 31st. So last year there was 657 requests for fans, and it was about 500 and something that the people were eligible, and we sent out a fan to those folks. And then more than 100 of these people were referred to a cool zones site. And so we don't have data on how many people at the libraries and the rec centers are using the site specifically because it's a cool zone. But we do know that we have these referrals that we're making every month during the summer. The biggest month for fans is September. And we've talked about our partners. So in this case, we have a lot of external partners too, who are the actual sites. And we welcome more. How to become a site. So if you go to the coolzones.org website, there's a standards of participation form that you can look at and see what the requirements are. We ask that you put the little logo in your window so people can see it. We ask that you allow people to be in your space for free. And that's pretty much it. And so we would love to sign up more sites. And right now we've got 120. And you can find the sites on that website. I showed you that map. It's a really cool website, very interactive. You can put in your address. You can specify if you want it to be 5 miles away from your address or 10 miles, whatever it is. And you'll see all of those that are near you. And you can also just print out a PDF of the sites. So then our disaster plan for people who may need assistance. And this includes preparing for extreme heat. So I think it's on page 36. There's some tips for extreme heat. And it also has like extra things for people, say, who have multiple medications and, ways to make sure you're going to have that organized before you're perhaps suddenly evacuating your house. And that can be found on Ready San Diego. And it's a really pretty cool action plan that your patients can use. And we're doing a series of Train the Trainer trainings. It started a few weeks ago. And so if your organization would like to be trained on how to train your patients to use it, or if you want to set up like a seminar or some kind of community health session, the idea is that you bring in people who want to make their disaster plans, and right there during that 45-minute session, everybody makes their action plan together. The guide itself is available in 12 languages. There's also an audio version. So we're trying to be very accessible. And that is it. This is one of our Cool Zones tables that we had just a few months ago. And so thank you, and I hope that you can recruit some Cool Zones.
Good afternoon, everyone. I want to especially thank San Diego County for allowing me to come out here and talk. I'm a meteorologist with NOAA, National Oceanic Atmospheric Administration at the National Weather Service. We actually serve more than just San Diego County. We serve Orange County, Riverside County, and San Bernardino County. So we have a very diverse region across Southwest California. We are a federal agency, so primarily what we're trying to do is coordinate with state, local agencies and getting the message out. So part of what we do is Weather Ready Nation. So we talked a lot about heat, and that's what we're going to talk about further here. But really our mission is Weather Ready Nation, everyone. On a personal note, my wife's an RN. Her brother is an MD, medical doctor. Her other brother's an attorney. So that loop in the family is common, that we discuss weather, but they get their weather information typically from their local media and from their smartphone. So that's just the state we live in now in 2023, is information is all over the place. So our mission at the National Weather Service is not necessarily to duplicate that, but to alert the public when it really matters, when it's different, when it's unusual, when it's threatening to their normal daily operations. So on the very tip of the iceberg and the very basic metric, we keep track, not just San Diego, but across the whole United States, on fatalities. And you're probably not surprised, and that's why we're here today. Heat is the number one in the United States, weather-related fatality. And across global, it's just staggering. We don't even have good numbers for it because it's not necessarily kept like we do in the United States, but globally, it's massive. Even in Southern California, where we have this tremendous, great Mediterranean climate, semi-arid climate, heat is number one. So we keep track of that locally. And that is just deaths. What we're really looking for are metrics like were shown before. What are the impacts from heat on your health or your lifestyle? Fans, number one, tremendous metric. ED, emergency department visits, tremendous metric in terms of measuring what is really the impact from unusual or excessive heat. So at the National Weather Service, I mentioned we issue life-threatening, property-threatening type of messaging. You're probably familiar with most of it because it gets rebroadcast in the media or your local TV outlets. We have the excessive heat watch, which is your earliest notice. Something is coming. Something is coming that's unusual. We have the warning. Okay, something is imminent or it's here very soon and it's unusual. We're not sending these messages out because it's 100 and 100 sounds like a good number. We're sending it out because it's unusual heat. And then we have the lower level, which is the heat advisory. And that is for those who are unprepared, the vulnerable populations, those with underlying health conditions, that type of group. The heat warning is for all of us. Even the one who thinks they're the most athletic in shape, running at 2 o'clock in the afternoon, even for those who say, well, I live here and I know how to handle it. The excessive heat warning is for the unusual event. Now, in order to figure that out and to show that seasonally throughout the year and to show that geographically, so meaning how do we apply it for an area like Borrego Springs where it's always hot in the summer? How do we apply it to an area in San Diego where it's always 75, 80 until it's 95 or 100? What we use is what's called heat risk. And the idea behind that and the science behind that is it looks at the departure from normal or the abnormal part of the heat. How unusual is the heat? Are we talking record temperatures? Are we talking average normal temperatures? By the way, normal temperatures that you hear when you're in an elevator with someone, boy, it's unusually warm, or this is not normal, is a 30-year average that's updated every 10 years, just like the census is updated every 10 years. So it's a 30-year average. So we compare to that 30-year average, and then we could look at the weather forecast or the actual prediction of temperature and come out with these different levels: the low, the moderate, the high, the extreme, or the very rare type of event. This is how we decide on what we're going to issue for a watch or a warning or advisory. Now, how does it come? Like under the hood, when you look under the hood for any location across the United States or Southern California, we look at the percentile. So just like in health, we're looking at the 95th percentile or higher. Where is it unusual? That given day in that given location. And that's how we're able to apply and warn the public only on those unusual events. Of course, you still got to predict the weather, right? So if you predict 80 and it's 100, you got a problem. But if you predict 98 degrees in San Diego and it's 98 degrees, it's a one-to-one correlation. This will flag it, and this will tell us we need to send out a message alerting the public that something is unusual. We look at the whole year. We look at, okay, it's never been this temperature before, or it's a record temperature, or it's a usual temperature. We're really keying in on the low percentage event or the 95th or greater percentile event. The reason being, most of those events, most of those days, most of those temperatures are associated with heat health risk. Something bad usually happens, especially to those unprepared, those with underlying conditions, but in some cases to anyone, you, me. I've experienced it in my own life. I've seen it happen on my daughter's soccer field. Most of the general population is going to make the decision. They're going to say, I'm used to it. I know what I'm doing. I got it under control. And that's when we end up tasking our emergency services. Now in San Diego, we have a much flatter line. Because we have a very temperate climate. We have a climate that is very modified by local marine air, cooler water. That's our air conditioner, cooler water in the Pacific. But even in San Diego, we have a threshold. And we have a threshold when we need to notify or alert. We need to take different action. We need to engage the plan that Corey talked about. We need to have the cooling centers because it ends up having a public health, like Snapdragon circa last year. This is what it looks like on a map across Southern California. The great thing about this tool or this prediction, if the weather forecast is accurate, we already know the climate information. The underlying climate information is easy. That's all statistics. We can apply the two together in any region, and it'll flag if it's normal, if it's unusual, if it's extreme, whether it's February during the Super Bowl, whether it's July 4th weekend, or today here in August. And this changes every day, every forecast, every prediction. But what doesn't change is the underlying base. That's moving along with it, the climatology, or what is considered normal. And it'll flag that. So once that is flagged, once we issue the watch, like Corey said, a few days in advance, once we issue the warning a couple days in advance, that's when we can engage the actions that we've been preparing for all along, once we issue those products. Now, there's other ways that we work with, like Corey or the county or other local partners. It's not just, okay, there's a watch warning. It's not just, oh, the heat risk is high, the heat risk is extreme. It's also sending out a message like this that we do on a daily basis that, hey, even before we get to the watch, before we get to activating the plan, that excessive temperatures and other types of weather events, but here we're talking about temperature, are expected in 3 days, in 5 days, in 7 days. And we do it in a format like this so that it's very easy to pinpoint, okay, something usual or something unusual is coming up. This is what it looks like to the public. So if you were just to type in weather.gov, or if you just type in heat watch, or you turn on Al Roker for NBC, this is typically what you see when something's in effect. The heat watch, then the heat advisories and warnings that come into play. A pretty picture, but a highlighting picture that it's not just local, like in this example, but it's expansive, extensive across a large area, affecting a lot of people. What we do behind the scenes is we look at the data. So we look at the daily temperatures. We look at what actually happened. How did the forecast pan out? What actually happened? This particular event, September of 2020, we looked at the actual temperatures, but it didn't stop there. It used to stop there, but it didn't stop there. We looked at the public health. How did it affect the health? How did it increase ED, emergency department visits? How did it affect local populations, whether they were prepared or not? And what were the symptoms? And what were the outcomes? So what we really want to know is beyond just, hey, it was 115 degrees in Escondido. That's never happened. That's great. That's bad. But what actually happened? What was the impact? And that's where the data from the county comes into play. Now, just an example of what have you done for me lately. September 2022, just last year, the hottest day on record in the state of California occurred. During the heat wave that was followed by Tropical Cyclone K, if you remember that, and we got some rain. So we're not just talking about heat that's in the future or heat that's predictable. We're talking about heat that's already occurring in our backyard right now. You can see the other events that are on there as well, like 2006, 2022, trumped it. Okay, what does it look like on a map? On a map, you're looking at excessive hot temperatures across the entire state to make that kind of record happen. You're looking at not just a one-day heat event, but a 2-week heat event in September of last year that came in first or second place. That's not where you want to come in first or second place when you're talking extreme or excessive heat waves. If you look at California as a whole, and I think you already know this, that's why you're here, the past 8 of 10 years are the top warmest. California as a whole. So that takes into account Palm Springs. That takes into account cool San Francisco. That takes into account Sacramento. That takes into account the beautiful climate of San Diego. Together, statewide, 8 of the past 10 years, top warmest. And that's annual temperatures. It's not just July. That's just not one day. Okay, finally here, what are we doing about it? Well, we're doing a lot of things, like we're meeting here today. But the Desert Research Institute and my agency, NOAA, National Oceanic Atmospheric Administration, are working together to how do we better inform the public, but how do we better educate the public or the underserved or the vulnerable or the population that's not paying attention? How do we better serve them? And we're looking at ways of doing that where we can train the trainer or teach others to help educate and make us a little bit better weather-ready nation. Make us a little smarter, make us a little more of planners, preparers. And this program that's taking effect in our own backyard here is doing that, coming up with some curriculum where we can educate and get everyone on the same page and better understand. What we're developing is a series of modules, and those series of modules can be taught by you, can be taught by anyone. The whole idea is that you don't necessarily have to be a subject matter expert, but you become a subject matter expert and you can teach others. And at the end of the day, save lives, cut down the morbidity, allow us to adapt a little bit better in this warming, changing climate. Thank you.